Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum. The infection is typically spread through direct contact with syphilitic sores, known as chancres, which can occur on the external genitals, anus, rectum, lips, or mouth. It can also be transmitted from an infected mother to her baby during pregnancy, leading to congenital syphilis, and rarely from the transfusion of infected blood. Syphilis progresses through 4 stages, each with distinct symptoms. In the primary stage, a painless sore or ulcer, also known as chancre, appears at the site of infection, typically within 3 weeks of exposure. The chancre may go unnoticed, especially if it's in a less visible area. The sore usually heals on its own within 3 to 6 weeks. The secondary stage occurs several weeks after the primary sore heals. Symptoms include skin rashes, often on the palms of the hands and soles of the feet, mucous membrane lesions, fever, swollen lymph nodes, sore throat, headaches, hair loss, weight loss, muscle aches, and fatigue. These symptoms may resolve without treatment, but can recur. Latent stage is asymptomatic, meaning no visible symptoms are present. The bacterium remains in the body and can stay dormant for years. Without treatment, the infection can progress to the tertiary stage. The tertiary stage can occur years to decades after the initial infection. It can cause severe damage to organs such as the heart, brain, nerves, eyes, blood vessels, liver, bones, and joints. Symptoms can include difficulty coordinating muscle movements, paralysis, numbness, blindness, and dementia. Tertiary syphilis can be fatal if untreated. Syphilis is diagnosed through several methods. Blood tests to detect antibodies to Treponema pallidum in the blood. Common tests include the rapid plasma reagin and the venereal disease research laboratory test, followed by confirmatory tests like the fluorescent treponemal antibody absorption or Treponema pallidum particle agglutination assay. Direct visualization of the bacteria using dark field microscopy from a sample taken from a chancre or sore. In cases of suspected neurosyphilis, a lumbar puncture may be performed to examine cerebrospinal fluid for the presence of the bacteria. The following regimens are recommended for syphilis treatment. For primary or secondary syphilis, benzathine penicillin, G 2.4 million units intramuscularly in a single dose. For early latent syphilis, benzathine penicillin G 2.4 million units IM in a single dose. For late latent syphilis or latent syphilis of unknown duration, benzathine penicillin G 7.2 million units total, administered as 3 doses of 2.4 million units intramuscularly, each at weekly intervals. In pregnancy, treatment appropriate to the stage of syphilis is recommended. For penicillin allergic patients, alternatives such as doxycycline or azithromycin may be used, although they are less effective than penicillin. Several strategies can be used to prevent syphilis, including safe sex practices. Consistent and correct use of condoms can reduce the risk of transmission, although it does not eliminate it entirely, as chancres can occur in areas not covered by a condom. Regular testing for sexually transmitted infections, including syphilis, is crucial, especially for individuals with multiple sexual partners. Engaging in sexual activities with only one uninfected partner who is also monogamous significantly reduces the risk. Pregnant women should be screened for syphilis during their first prenatal visit to prevent congenital syphilis. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative health content. Stay tuned for our next video.